And then we're welcoming back Mercedes Rodriguez Celin. She's talking about the evaluation of mobility-associated symptoms in Argentinian patients with OI and application of the STEMS tool.
Hi. Well, last time I promise. So I am grateful to be sharing this with you, really, and I am representing people from Argentina that were not able to come. I am working at trainers at UIC, moving to Wisconsin, but really I worked 10 years at Garrahan Pediatric Hospital before moving to the US, and they have a very large skeletal dysplasia clinic that is directed by Dr. Fano and Dr. Del Pino, and Dr. Ramos Mejia was the one that directed this study, and I was very happy to be included and to be able to collaborate with them. And we also work with Dr. Ireland, that was the one that designed this tool in Australia. She has lots of experience working with skeletal dysplasia. And what we did in Argentina, it was to replicate the experience that she had in Australia with this tool and try it in our population of patients with OI and with other skeletal dysplasia. I am bringing here today the results of this study, mostly the OI results, but we already submitted for publication, and you will be able to see the results in other skeletal dysplasia too, hopefully soon. So with that explanation, the idea, well, you know that OI, biomechanical alterations that are associated with OI, such as short stature, bone deformity, scoliosis, may predispose to the presence of symptoms associated with mobility. So this tool, that is the screening tool for everyday mobility and symptoms, that I will call STEMS because it's very long, assess mobility and associated symptoms in people with skeletal dysplasia that are older than 5 years old. So this was designed for people with skeletal dysplasia, so that's very good. So the objective of this study is to assess the presence of symptoms associated with mobility in everyday settings in people with OI using the STEMS, and we translated to Spanish. And the idea also, like a second objective, is to compare the results of STEMS between OI and achondroplasia, because that was the other larger population that we have in their skeletal dysplasia clinic now in Argentina, and to compare the Argentinian results with the Australian results that were the original publication in 2021. So this is a descriptive study that, as I said, it was performed at Hospital Garrahan in Argentina, in Buenos Aires. All the individuals were assessed in the skeletal dysplasia clinic, their patients and their family members that were also affected. So the different variables that we included were gender, the severity of the condition, then also this is part of the growth and development department, so we assess also all the anthropometry parameters such as height, weight, BMI, socioeconomic and environmental information, the therapies, if the patient had rotting, spine surgery, bisphosphonates, physical therapy, the use of assisted device using the STEMS, and also we compare the results of the STEMS with other scales that evaluated pain, like the visual and analog scale, and scales of fatigue using the PROMIS scale. So it's a very easy tool to use, and that's why I think that's one of the good things that STEM has. And the idea is that these scales is ask the participants about a limitation in mobility associated with pain or with fatigue. So it's asked if you are limited by pain or by fatigue or by both things. And it also asks about the mobility devices, if the participant is using or not different mobility devices. So already in a chart you have 2 or 3 big informations, and also you ask in different settings. You can see at home, at school or work, or in the community in real life and moving everywhere. So we were able to include 55 participants that had OI, most of them from Buenos Aires. 56% were female. And the age range was, so most of them were pediatric. This is a pediatric hospital with a median age of 13-year-old, but with a range between 5 and 46 years. So most of the participants have social security. That's something that in Argentina happened, thankfully. Most of them were able to go to school and to the grade that it was expected. 36% of the participants received palmindronate, 35% underwent rodding surgery, 9% had spine surgery, and 35% of the participants were doing physical therapy that sometimes is difficult to find. 44% were using assisted devices, and you can see that the percentage change depending the setting. So we found our results were that 62% of the individuals reported using this tool having pain, 86% of the individuals reported having fatigue, so this is very high, and 53% reported having pain and fatigue. The symptoms were more frequently associated with the outdoor settings, in adults. We spoke about age many times today, and also in mild forms of the disease. And mild, we are speaking about type 1, but we also asked today what is to have a mild form, but it seems like this was more frequent, but still it was not a significant difference. And the symptoms were less frequent among the ones that were receiving bisphosphonate. We spoke about this today among the ones that were doing physical therapies, and unfortunately many of them were not, didn't have access to this. And it was least frequent in the ones that had assisted device. Pain intensity was ranged with a median of 4, fatigue intensity with a median of 14. These were our results. We found correlation between the different scales and using also the STEM, so that's good. And we were able to compare with achondroplasia, as I said. So the presence of symptoms, you can see, was more frequent. So here you can see in gray is achondroplasia and in green is OI. So you can see that the presence of symptoms was more frequent in people with achondroplasia comparing to OI. The intensity of the fatigue and the pain was similar across both conditions. And we also wanted to compare our results with the Australian results, with the original report, and we found that the distribution of symptoms was comparing among the original publication that you can find the site there for everyone that is interested in reading it. But in our population, there was a higher frequency of symptoms at school and work. Is easy, is fast. 90 seconds was the time to use this tool, so it can be like something good to start. 100% reported that it was easy, so the patient we asked, this was easy, do you have any difficulty? Nobody replied having any difficulty, so it seems like it might be useful. So the conclusions is that STEM detect the presence of pain and fatigue associated with mobility in a high percentage of people with OI. The symptoms usually, as we know, sometimes are naturalized and interfere with function, and the presence and intensity of symptoms were related with many variables, as you saw with having surgery or with, when in the case of biphosphonate, it was less intensity when they were using this type of treatment. We want to thank the families, Hospital Garaham, and all the patients. We want to thank also Dr. Ireland from Australia that collaborate with us. And of course, I want to thank the people from Garaham that I am representing right now. And here are the emails if you want to contact them or if you want to contact me. Thank you.
Thank you, Mercedes.